Introducing KneeEase for post-surgical knee rehabilitation at home. KneeEase is a device that can be delivered to a patient's home following knee replacement surgery, ACL repair, or any other procedure requiring range of motion recovery in the knee. KneeEase grows out of the observation that muscle guarding and apprehension slow patients' recovery down. By putting patients in control of their own range of motion, we eliminate muscle guarding and the apprehension that frequently slows patients down in their recovery. KneeEase is easy to set up, generally taking about 30 seconds to set up in a patient's home. The patient is taught how to position themselves on the machine, how to strap themselves down to isolate their knee, and how to use the joystick to move their knee passively. Patients get instant feedback on the angle of their knee throughout the therapy process. And they can see not only the exact angle of their knee, but their total time on the machine in this session and a hold time so that they can hold at their maximum flexion or extension. KneeEase passively moves the knee through the full range of motion, -5 degrees to 130 degrees. If you're interested in KneeEase for your patients, contact Gary Morgan or call 888-886-4368.